Welcome to the eye-opening world of breast cancer, an uninvited guest in 1 out of every 8 women's lives worldwide. That's right. Startling as it may be, around 12% of women will develop breast cancer during their lifetime, and it doesn't discriminate between genders either, even though it's less common in men. We are living in an era where the incidence of breast cancer is rising at an alarming rate. Factors fueling this surge are complex and varied, ranging from our genetic makeup to lifestyle choices, environmental factors, and even the intricate interactions between them. But why are we discussing this? Because understanding these factors can be our guide to prevention. Over the next minutes, we'll unlock this Pandora's box, unearthing symptoms, digging into the risk factors, and unveiling preventive measures against breast cancer. Knowledge, after all, is our shield and sword in this battle against the disease. So let's stride forward to grasp it. Moving on to the second minute of our exploration, we step into the realm of symptoms, beginning with noticeable physical changes. Can you believe that nearly 90% of breast cancers are first discovered by women themselves, often as a new lump or mass in the breast? Now, this isn't always cause for alarm. Not all lumps are cancerous, but a hard mass that has irregular edges is more likely to be cancerous. Next, look out for changes in the size or shape of the breast. While our bodies change as we age, a significant or sudden alteration warrants attention. And if you see redness, pitting, or an orange peel-like texture on the skin of the breast, don't dismiss it. These can be symptoms of inflammatory breast cancer, a rare but aggressive form. We hope you're taking notes because these signs might just tip the scales towards early detection, vastly improving prognosis. So let's keep going. As we step into our third minute, we spotlight another potential indicator of breast cancer, persistent breast and armpit pain. What's shocking is that approximately 15% of women diagnosed with breast cancer had experienced these discomforts. Now, it's crucial to note that while pain can be a symptom, breast cancer is often painless in its early stages. But any persistent, unexplained pain, especially if it's concentrated in one specific area, should be a signal for medical consultation. Also, while we're talking about the armpit, let's not forget the lymph nodes. Unexplained swelling or lumps in the underarm area, even if you can't feel a lump in the breast, should prompt an immediate doctor's visit. Yes, breast cancer can be a silent invader, but these signs might be the alarm bells that give us a fighting chance against it. So with keen awareness and vigilance, let's step into the world of risk factors next. Navigating through the intricacies of breast cancer, we now come to an important juncture: the role of genetics and family history. The branches of our family tree often hold secrets, some of which can influence our health. In the context of breast cancer, 5 to 10% of cases are linked to specific inherited genetic mutations, most commonly BRCA1 and BRCA2. The stakes are high. Women with these mutations have an astonishing 72% and 69% lifetime risk of developing breast cancer, respectively. But genes are not the only inherited risk. Your risk nearly doubles if a first-degree relative, a mother, sister, or daughter, has been diagnosed with the disease. It might seem overwhelming, but understanding our genetic predisposition can provide invaluable guidance towards closer monitoring and early detection. And remember, genes are not our destiny. Stay with us as we dive into how lifestyle choices can significantly influence this risk. Stepping into the sphere of lifestyle choices, we find a plethora of elements under our control that could significantly impact breast cancer risk. Believe it or not, about 42% of breast cancer cases in the U.S. are linked to modifiable risk factors. For instance, alcohol. It's a grim fact that women who consume 2 to 3 alcoholic drinks per day have a 20% higher risk compared to non-drinkers. Moreover, a sedentary lifestyle and obesity, especially after menopause, increases the risk, with obesity raising the odds by up to 40%. Now let's talk about hormone replacement therapy, HRT. Women using combined HRT have a 75% higher chance of being diagnosed with breast cancer compared to non-users. The correlation between these lifestyle choices and breast cancer risk underscores the immense power we hold in shaping our health destinies. But with power comes responsibility. Stay tuned as we delve into strategies for wielding this power effectively and reducing our risk. Let's arm ourselves with strategies for early detection and prevention of breast cancer. One might argue, prevention is the best cure, and in the case of breast cancer, this holds true. Consider this staggering statistic. Regular screening tests can reduce breast cancer deaths by 20–40%, Mammograms, the most common screening test, can often detect lumps even before they can be felt. They are recommended annually for women aged 40 and above. Additionally, clinical breast exams by healthcare professionals are suggested every 3 years for women in their 20s and 30s. But it doesn't stop there. It's equally crucial to perform regular self-examinations. Around 40% of diagnosed breast cancers are detected by women who feel a lump. The reality of early detection is, the sooner it's found, the better the chances for successful treatment. Let's continue to explore how lifestyle modifications can also be a potent weapon in this battle. Let's explore how lifestyle modifications can be a potent weapon in our arsenal against breast cancer. Let's start with the word on everyone's lips: diet. A study has revealed that a Mediterranean diet supplemented with extra virgin olive oil and nuts could reduce the risk of breast cancer by a staggering 68%. Moving on, physical activity is another cornerstone of prevention. Engaging in regular exercise can lower the risk of breast cancer by up to 25%. Then there's alcohol. Limiting intake to no more than 1 drink per day could help reduce risk. While each modification on its own may seem small, the collective impact can be substantial. Furthermore, it's never too late to start making these changes. As we shed light on the power of lifestyle modifications, we also acknowledge the courage and strength of those already battling breast cancer. Our journey continues as we delve into the final minute, exploring how we can support those diagnosed. As we step into the final minute of our journey, let's talk about support, survivorship, and wrap up the crucial information we've unpacked. Being diagnosed with breast cancer can be overwhelming, but remember, you're not alone. From doctors and nurses to friends, family, and numerous breast cancer organizations, a strong support network exists. Let's also take a moment to applaud the strength of the 3.8 million breast cancer survivors in the U.S. These warriors prove that a diagnosis isn't the end, but rather a new beginning. In conclusion, breast cancer is a multifaceted issue, influenced by both uncontrollable factors like genetics and those within our control like lifestyle choices. By understanding our risks and embracing prevention strategies, we can all be active participants in this battle. Breast cancer awareness goes beyond the statistics and facts. It touches on the lives of countless individuals around the world. Understanding its complexity requires acknowledging its personal and emotional impact. Many survivors, families, and communities actively engage in spreading awareness, supporting research, and creating a network of care and understanding. Your participation in local events, donations, and routine self-examinations can be part of a larger movement towards hope and healing. Remember, early detection is a life-saving tool, and we must be vigilant and compassionate in our approach to this global health concern. We can all be active participants in this battle. If you found this information helpful, do subscribe to our channel. We're committed to bringing you the facts you need to take charge of your health. Together, we can turn the tide against breast cancer.